Welcome to the Talk, Listen, and Collaborate podcast, where we explore ideas shaping the future of teaching and learning at AT University. This season, we're featuring a special series titled Voices of Leadership, Reflections on the Future of Health Science Education. Each episode brings institutional leaders and thought partners into a conversation about reflection, innovation, and evolving role of faculty development across ATSU. In today's episode, we're joined by the deans of ATSU's 2 dental schools for a conversation about the future of oral health education and institutional innovation. Here with me is my host, Emily from the TLC team. Emily, who do we have the pleasure of speaking with today?
Today's guests are 2 ATSU leaders in dental education with deep commitments to public health, community care, and the next generation of healthcare professionals. Dr. Don Altman is the interim dean of AT University, Missouri School of Dentistry and Oral Health, ATSU MOSDOH, and the university's vice chancellor of academic support. He's been with ATSU since 2006 and is a diplomat of the American Board of Dental Public Health. Dr. Altman has also served as president of the Arizona Public Health Association, the American Board of Dental Public Health, and the Arizona State Board of Dental Examiners. Dr. Des Gallagher is the 3rd dean of AT Still University's Arizona School of Dentistry and Oral Health, ATSU ASDOH. A champion of whole person healthcare, he focuses his leadership on expanding care for underserved populations and individuals with special needs. His current research and professional passion lie in interprofessional collaborative care, helping healthcare teams work together to treat the patient, not just the disease.
Welcome, Dr. Altman, Dr. Gallagher.
Thank you so much for having us today.
Thank you.
Absolutely. Before we dive into our discussion, and if I may start with you, Des, what's something that's brought joy or energy to your work this semester?
I think the students always bring me a lot of energy and a lot of joy. Coming back, just talking with them, hearing what they've done over the break, what they plan to do, the energy they bring back, particularly when they come back from their rotations, our 4th-year students who are heading towards graduation, the energy, kind of their sight of where they're heading to as they get ready for graduation. And really, they walk a little bit taller because they really got to experience what it's like to be a practitioner in a clinical setting, a little bit different to our clinics here as well. So that always brings me a lot of energy as we look towards May and we get ready for graduating, our class of 2026. And also admissions, we're going through interviews for our class of 2030. And I love meeting with those students, hearing about their experiences and what are they looking for and their energy as they start the next 4 years of hopefully a relationship with us, but their dental education journey.
I get that. It's that energy for different reasons. Those that are beginning their dream of becoming a dentist and those that are a step away from becoming dentists. I get that. That's got to be exciting. Fantastic. How about you, Don? What's something that's bringing you joy or energy in your work this semester?
So last semester was my first and only semester as the dean at MOSDOH, but I was the interim dean here back in 2016. So it was really kind of fun to come back and see the growth of the school from 2016 to 2025, to reconnect with faculty and staff that were here back in 2016. And then really just to learn the processes. It's a different dental school with 2 different campuses, 3 hours apart. So there's challenges there that have been interesting to tackle. One of the things, and Dr. Gallagher kind of mentioned it, that I particularly have liked this, it was just December. In our interview process, our admissions process, I made a point to be in Kirksville every time there was an admissions to welcome the folks that were coming, to actually thank them for considering us for their dental education. And then on the very first day of being able to give acceptances to applicants, I called first thing in the morning, every single person that we were offering acceptance to, which was like almost 90 something students I called in that morning. And it was amazing. People were crying. People were so excited. I mean, I just told them, I don't know if you're going to come to us. You got but congratulations, because this is a huge step to start a dental. I remember being accepted and how exciting that was. So not only did it bring me back, but it was so nice to be able to, some of them, wake them up at 8 a.m. and let them know that they've been accepted to dental school. So that was really rewarding.
Wow. I just got goosebumps hearing that. That is an amazing experience and probably extremely motivating for why you do, both of you do what you do. It's all about the students, right? They're making that phone call. They don't even know it half the time. They're barely awake, and their destiny is changed by that phone call and hearing that from you. That's amazing. That's amazing. Well, I'd like to try to keep that energy going here and open the conversation by asking a reflection question. I'll start with you, Don, and ask you, what would you say has been the most pivotal moment in your career that helped shape you, who you are, have become as an educator?
Oh, gosh. I started 19 years ago with ATSU and with ASDOH and our online college, and that was why I was hired. And while I had taught before that, I was brought onto the university to create an online certificate and dual degree program. And I had never taught in online education. And 20 years ago, it was still in its infancy and has changed quite a bit. But that was a pretty big step in my education, from standing in front and giving lectures to a different mode of education and something that was catching on. And the fact that I wrote every single course in a certificate and a master's program and taught every single course to every single ASDOH student was an eye opener, for one, having to do all of that myself, because it was a program of one. But I think it really shaped my idea of, education is and students are not interested in really just sitting in a lecture in a room and having you lecture to them. And because what I found was pretty much they're on their computers doing other things anyway. So I felt like what I really liked about the online part of teaching dental students is that literally every student has to participate every single week. And so online, I knew that they were at least getting the basics because they had to respond. In class, 4 or 5 people talk. The rest of the people don't do anything, are not participating. I don't know whether or not those other people are actually understanding and hearing what I have to say. So it was a big shift for me of the value and the potential impact of online education in dentistry.
That's fascinating to think about, like how far online education has come and what is different, but also the same since you started. So thank you for sharing. Des, I'll ask you the same question. Can you think about a pivotal moment that you would recall that has helped shape you as an educator?
Yeah, sure. I just to give a little background, I started after dental school. I served in the military as a dental officer, so I did about 7 years, and I got involved a little bit with organising, some continuing education when I was overseas. And from there, I went in, started up my practice, and I was in practice for a number of years. Started to do some postgraduate at the local school, and then got involved in part-time educating on clinic. And really at that stage, as I started off as an instructor, it was more about, the technical aspect about, how are we doing a procedure? Is the procedure correct? Good outcomes as well. And the great thing with that is as I did more of that, I really started to enjoy the educational side of actually thinking about, how do you relate something that I do every day in practice, a clinical skill, into something that can help somebody to kind of bring together, synthesize the information they've had in simulation with didactic materials, and then actually apply it to, a patient encounter. And as I started to do that part-time teaching, I got to see, the light bulb moment when the students would actually connect everything together, which was really kind of rewarding. And from that, it really made me want to go further into education and kind of move from solely in practice into sort of an educational pathway. And in that decision, I moved forward to take on a full-time position, and I was lucky to join the University of the Pacific, the Arthur A. Degoni School, as a group practice leader. So they were going through kind of a model of moving from a siloed clinical education where, as a student, you would go to specific areas for specific procedures, to go more towards a general practice where you're kind of going through a competency education which replicates what you're going to do when you're in practice. But as I moved into kind of that role, the philosophy of the school was really around a humanistic model of education. And I think that really made a huge impact on me, and there's still a lens that I always look at education. Is I was fortunate enough to work with Dr. Degoni, and he very much had a philosophy that we all grow students, but they become doctors on the way. And that made me think a lot differently about what we're doing. And, you know, reflecting on how I went through dental school, it wasn't always humanistic. It was sometimes, you know, not so good in front of a patient when your shortcomings were shown up. And it made me really think more about how do we grow that person. You know, clinical excellence is an expectation around what they're doing, but, you know, how do I support them? How do I look at that person, help them with their communication? They're a young person. They're moving into a profession. So how do we grow them? How do we help them to become their best person? How can I show them how to communicate with the patient? How do I show them, you know, how to build trust, how to grow them? And then as they go along, you know, they're going to show that they're becoming competent. They're going to be a safe beginning practitioner as well. So that's something that always resonates me to this moment, this thinking about not always the technical, but really thinking about the person, who they are, and how do we help them to grow. They're a young person. How do we grow them into a doctor who's going to be empathetic, who's going to be able to listen, is going to, you know, be able to do the best thing and give the patient the best outcome as well.
Yeah, thank you both for sharing those reflections. I'm going to take us to a more future-oriented question. So looking ahead, what trends do you think will most impact health profession education in the next 5 to 10 years?
Yeah, I'll maybe start off on that. It's something, you know, that I think a lot about. Obviously, initially, as we look at the students coming in, they have different ways of learning. They have different kind of expectations of education. But I think when you look at the educational model that we're in, but also where the profession is going to, obviously AI, technology, robotics particularly, the way that we practice, I think there's challenges, particularly for our educational model where AI, some of the diagnostics within AI, how AI is used in practice outside, from writing notes, from doing a lot of things that traditionally, you know, was either the doctor or the team that would actually do it. So I think AI is one of these trends. How do we show the students what AI can do? Because it can be a really amazing tool, particularly utilizing it for, you know, helping maybe students to interpret, understand, maybe say radiographs, for example. But then how do we make sure that we're still educating the student, developing critical thinking, clinical reasoning skills, so that they do know that maybe when the AI isn't quite right, that something isn't quite right there as well. I think the other aspect is really looking at maybe the scope of practice. Maybe some aspects could be maybe done by robots. That there's certain technologies that are emerging at the moment. So maybe some procedures may be a little more automated than they are now. So looking at what we're teaching students around maybe some of this speciality, some of the areas that are a little bit harder to mechanize. So again, looking at maybe pediatric dentistry, looking at maybe geriatric dentistry, looking at maybe aspects of removable dentures. Again, maybe giving them a higher level of training in some of these areas so they're prepared to treat some of the cases that are maybe not prone to becoming automated or being able to be treated by different robotic methods. And then I think as well about looking at the whole medical dental integration. That's something that as we move forward, there's a greater kind of convergence, particularly around sort of some of the reimbursement models, some of the value-based models out there as well. But also with patients looking for coming to see a dentist, are there things that we could do around some of the predictive? So biomarkers, obviously saliva is our world. What could we do to be part of a more integrated kind of healthcare model to help that patient navigate? There's literature that says about 27 million, so about the population of Texas, sees a dentist but doesn't have a primary care provider. So again, our role in that as part of the overall healthcare system, how is that going to develop as patients look at a more personalized service? Again, how can we offer that? How can we look at our scope of practice so that we're preparing students for, different models of practice that are going to emerge over the next, 20 to 30 years, so that they're going to be prepared for technology, for different ways of actually delivering really good reproducible outcomes to patients as well.
Thanks.
It's hard to wait after that.
Yeah, Don, do you have a response to that?
Yeah, so clearly the bigger picture is technology, and the technology is changing so quickly, and it has a huge impact on what we could do in dental education if we could afford the technology. And many times when you are the first with some technology, in 2 or 3 years, it's outdated again. And it makes it really hard with how quickly technology is moving, AI, to really know what's the best, because next year it might be something else. And changing your curriculum is a slow process, not a very quick process. I do think that AI will have an impact on the way we teach and educate in the clinic, but it also has to do with clinical practice when they get out. So there's two different things going on here, because I think that AI can provide us with a lot of teaching methods with haptics and not having to use plastic teeth, and really being able to tell a student how the pressure and how this feels, and all of this virtually. But it also provides us with tools to make dentistry more precise clinically and quicker. I'm not sure it makes it cheaper because the technology is so expensive, but it is quicker. You can fabricate a crown in an office in an hour, and you send it off to a lab, and it's 2 weeks. So things definitely get a lot quicker with AI. It kind of to dovetail on some of the things that Dr. Gallagher said, in dentistry, we're really good about, we have layers of professionals, right? So we tend to let our dental hygienists do a large scope of work. We have expanded practice dental assistants and then regular dental assistants. And so where does AI fit into that? What else is being taken off the dentist's plate that AI can do that a hygienist is not doing, a dental assistant expanded function is not doing? And then it gets to the point that dovetails with Dr. Gallagher is really, what are we teaching in school? Because we need to move away from stressing so much about the precision, because computers and technology is going to help us with that anyway. But how do you teach those critical thinking, emotional intelligence, ethics, compassion, those sort of skills that if AI gives you something, how do you move from the, is this correct, for one thing? But in education, we need to move from the what do I do to why am I doing it? So it's one thing to say, this needs a crown and a partial, but why? Why do we need that? And I think we do a good job of the what, because we're asking them to do a treatment plan. I'm not sure how well we teach them to think critically on the why. And I think that AI is going to enable us to teach alongside the student, work with them, as opposed to um, telling them not to use AI. Just an example would be, a simple case study and being there with the student and saying, okay, so here's the case. Let's put it in AI and see what it says that we would do. And then and make that the simple part. But then you have to pivot. Oh, but what happens if the patient actually had an autoimmune disease? Or what if they had a dry mouth? And you continue to add the pivots in there that make them think about, well, now what? Now why am I doing it? Why did I change? So I think it's going to change the way we teach. It should change the way we teach. My concern is accreditors keeping up with what we want to do, and outside practice, particularly community health centers where so many of our students go. Do they have the technology that we're teaching them in school to then be able to use? And are we getting rid of the old ways when in fact they may go someplace where they need to know the old ways? So it's a time of a real flux of teaching the old and teaching the new and really preparing them to be wherever they might be to practice.
I think as well, kind of with some of the points Dr. Altman brought up, I mean, it does present us with some great opportunities, particularly haptic, the ability for students to practice, what otherwise can be irreversible procedures to get it right. They're doing their first crown preparation. There's technology where they can scan the patient's mouth, they can practice it, get feedback. Also, the feedback that some of the systems provide, because you always get a level of, if it's a human providing feedback, is the measurement millimeter-wise correct? Whereas, obviously, the measurements that the system is going to give is going to be probably less debated because it's sort of the way that it measures is sort of reproducible. But I think one of the really exciting things is that we can potentially personalize some of the learning. I know we've had some great sort of experiences where, particularly within our ethics, they've used, a chatbot as the patient. And what was interesting is within the class of 70 odd students, they all had a slightly different conversation, which I think is really interesting as a tool to kind of help us to kind of develop some of the students' critical thinking. So I think within our educational processes, I do think there's kind of opportunities even around, faculty development and faculty calibration with some of the tools that are there to kind of help us to do that maybe more effectively than we do at the moment.
Yeah, certainly a lot of those points about technology are very important, which kind of leads into another question that maybe you feel you've already provided some response for, but if there's anything else that you would like to comment on, I'll just ask you this about technology specifically. So simulation and technology, of course, are hot topics. What excites you most about the role of simulation, AI, or digital tools in teaching?
I again, Dr. Gallagher has already alluded to it, but I think the fact that you can practice over and over and over on not just a large procedure, but on any procedure, and you're not harming a patient. So, now we do in our simulation clinics, they're working on a plastic tooth. These, each tooth is they're not cheap, right? And so it's like, well, how many times how many teeth do you get? In simulation in an AI environment, you can just continue to keep doing it until you get it right, and you don't have to be in a sim lab to do it. So I think that's pretty exciting. I'm old school, so I think there's like great value in actually working on a cadaver as opposed to a hologram or something virtual. But I think that I'm being old school because I do think that technology is such, the haptic stuff that it actually feels like, and the pressure, and you can measure all of those things and feel all of those things, is that perhaps at some point we won't need head and neck anatomy and actually working on cadavers. In fact, I think some schools don't do it now anyway. So that for me is pretty exciting if the technology continues to advance.
Yeah, I think as well it gives us, I often think about the way that we educate within both well, within healthcare education, it's pretty traditional, and things have evolved, but then they haven't evolved as well. In that, sim clinic, we get the students to work on pretty orthodontically well-arranged arches. There's no saliva. It's a great simulation around the technical aspect. And I think what's great with some of the haptic technology is that you can actually scan real patients. You can have a lot more occlusal anomalies. You can, put in a lot of different things that actually challenges as we're looking at how do we sort of invoke, critical thinking and really getting them to sort of apply the different layers of learning as they synthesize with a unique patient case as well. So I think it probably potentially offers us more opportunities. The other thing that I've been pretty excited about is some of the 3D printing technology. And we've looked at, particularly to Dr. Altman's point, that there's some amazing not scanners, but printers that actually can do layered body parts. So one of the things we were looking at is around dental implants, but also around surgery as well, in that you can actually print bone, soft tissue, muscle, skin, and the texture and the feel is something that it's not exactly like, but it's pretty close to where you're going to be able to practice repeatedly. So a little bit like cadavers, but this is something that is a lot more reproducible. So I know that's something that we've been excited about. Is that an opportunity, particularly for different surgical procedures where, we have under accreditation where we would have certain requirements for certain experiences? And is it possible to use simulation to give students a real world experience of surgery, of placing implants, etc., before they actually do it on a real patient? But the level of realism is elevated. And I think as we look at, to Dr. Allman's point, that there's so much technology outside that I think as a university having a look at with what we're doing at the moment around 3D printing, but is there more opportunities around generating anatomical parts, for example, that you can actually practice different procedures on, but really looking at, are there things that we can take? So again, on anatomy, I had the experience where at a previous school, we had cadavers, and then it basically changed into the use of what was called a anatomosh. So it was a table that was the size of a cadaver, but it had, I remember looking through, it had like a patient who'd died of an aneurysm, somebody else who'd passed away because of something else. And it gives you that opportunity to actually expose students not to what's common, but also to other, conditions, etc. So they get that exposure as well. So I do think looking at what we're teaching, we can, teach what happens commonly, but also have the opportunity to add in different scenarios, which will help to kind of grow their experience and really make them a really well-rounded practitioner at the end of it.
It's that practice that there's some value here that we understand with technology. Exciting. If I may, I want to shine a spotlight on something you said, Dr. Gallagher, about we're evolving, but we haven't evolved. I imagine that there are faculty and people around dental education that might feel a certain way about all these advances. I'm curious to get your take on how do you support those that might feel hesitant about embracing these emerging technologies? Do you have thoughts on that?
Yeah, I usually look upon this, I try to look upon resistance or kind of, unease. Nobody likes change. And I tried to kind of lay it out to faculties. If you look at, even if I look at my career, when I first went to dental school, there was a lot of things really around materials we were using. So we were using amalgam more so than even like glass ionomers or composites. We were using a lot more gold, a lot more materials that are different to what we use now. And if you look at your own career, look at the expectations around licensure of, continuing education, really looking at how you evolved as a practitioner. The way that most of them practice now is completely different, to how they practiced when they were at dental school. We have, faculty who've been in clinical practice for 50 years. So we do have a large jump. And again, trying to relate it to, most of them would have a smartphone, most of them would have adapted to technology. So it's really looking on, how do we help you to kind of understand this? And it's really taking a step back, helping them to understand that, the students are probably going to have more knowledge than they ever will, or they'll have more comfort in using the technology. But really, how do we support them, and how do we maybe give them additional help to kind of understand the system, understand, how we move forward? So, for example, we've just changed our electronic health record. So we've moved towards a different system, which has a different operating platform. And again, it causes a lot of frustration because, everybody's used to using a certain way. And again, it's looking at how do we empower, some faculty to be able to be navigators, but also how do we kind of meet them where they are, and how do we sit down, okay, this is what you're struggling with, let's help you to get through this. How do we maybe make little cheat sheets, or, there's different ways that we can support people, but it is sometimes a case of having to meet them where they are, sit down and provide that little bit of extra support to help them, move forward. And then understanding nobody wants to look as if they don't know what they're doing, particularly if they're an educator in front of students. So, being kind of, thoughtful of meets them where they are, but helping them to kind of be empowered to understand, the system and what they're using as well.
Yeah, meet them where they are. That's profound for sure. Dr. Altman, do you have thoughts about faculty, staff who might be demonstrating some trepidation towards these emerging technologies?
Yeah, I think you just have to start slow. You got to stick your toe in the water. You do need to make sure that, we have digital dentistry area and folks that are happy to teach faculty, the different machines, technology that we have. And you do have to kind of do that in a calibration sessions, or when faculty are meeting, not with the student, because they do not want to look as if they don't know what they're doing, and then that the student might know more than them. So you do have to just move pretty slow on it. But I think all of our faculty realize there's technology. We have a lot of technology in the school, and that at some point they need to progress, and they do at their own pace. But they do. But I think you have to just know, the person's comfort level. We have lots of folks that are retired, and so they've been doing dentistry the way they've been doing it for a long time, and some of this is totally new. So sometimes it's a little bit more patient. I've actually found, though, that our retired folks are some of the most eager to learn the new stuff. Like, they've been doing maybe the old stuff for so long that it's like, oh, well, this is pretty cool. Wish I'd have had this when I was in practice, sort of thing. So everybody's going to be a little bit different, but I do, we have an old electronic dental system. But I have found that even when we change things like grading and, going through Qualtrics, those are more difficult for the faculty than the actual technology for clinical work. Like doing the computer stuff, the changing of grading, it just seems to be more overwhelming than actual dental technology.
Interesting point. Yeah, those things tend to change often, which I'm sure that clinical technology does too. But certainly we're all accustomed to, helping folks through changes and worries and the struggle of the day and whatnot, striving for progress. And my next question is, from a leadership perspective, what keeps you up at night, perhaps, when you think about the future of teaching and learning?
So I'll maybe start off. Obviously, the cost of education and the student debt, and the model we have, not just in Arizona, but across the whole of healthcare education. And, particularly for us at AT Still, our mission is around, we have hometown scholars. We have a lot of ways to try to bring people into the profession. And, sometimes that level of debt that you're going to carry, it's overwhelming for a lot of people, or overwhelming if, your parents have never had that level of debt. So I think it's something that, how do we help students? And then, how do we look at different ways? Are there different ways that we could look at reducing the cost? I always feel, having been as a clinical dean before, dental schools provide a lot of safety net care, a lot of care to the community, to the underserved. And, I feel that that's not always fully recognized. So is there more that we could do on advocacy with our state? There's been some tremendous changes within, the Center for Medicaid around sort of billing what you can get around medical dental kind of reimbursement as well. So again, looking at other things that we could do as an institution to try to offset some of that cost, even look at maybe different models. Is there ways that we work with the military and they kind of sponsor students? Is that something we could maybe do with, maybe looking at HRSA reimbursement, maybe look at it in a different way, maybe look at with our students, some of them were going to go into, DSOs or other organizations, again, just looking at things differently. How do we maybe look at other ways that we could set up endowments, or other ways that we could help our students navigate through, but make sure at the end that they have something that is manageable for them. They can see the return on investment they've made, but they can also not feel that they're in a position where they can't make a decision. If they really do want to go into, say, the federally qualified health centers or serve underserved communities, that they do have a choice as well.
Sort of on that same vein, but maybe a little different take that keeps me up. And yes, the tuition is incredibly high, and we're a tuition-dependent university. And we've struggled for years on, like, what are we going to do? At some point, you just can't keep raising tuition. In dentistry right now, there's no shortage of individuals that want to go to dental school, and dentists are still making really, in my opinion, a really great salary just when they graduate after 4 years. So there is at this point still the ability to pay off that loan. But that won't always happen. I mean, dentistry is cyclical, and there's times when there's going to be too many dentists and too many dental schools, or too large classes in dental schools. It's just it just is inevitable that will happen. I think that really things that keeps me up right now, though, is the fact that the Grad Plus loans that basically are going away, and the amount of money that a student can actually borrow from the federal government is not near enough to pay for 4 years of dental school. And while we are pretty diligent about providing the students with information about where they can get private loans, I'm concerned that there will be students that will be left behind because they either have bad credit or they have nobody to co-sign on that loan. And I think that's going to, for a university whose mission is to try to recruit folks to go back to underserved areas, and how will that affect us carrying out that mission? Because I think some people are going to get left out of the field. So that keeps me up a little bit. I know the university is doing a good job and is keeping up on that, and it's too soon to know how that's going to be. But as dentistry continues to be more expensive, the loans that they can get for the federal government are going to be even a smaller percentage of that total. So I do think that we need more things like WICHE, which they pay for the education as long as you go back to the state in which is participating. And in Missouri, they have a Kit Bond, who is a senator at a foundation or whatever, that will pay for a dental student's 3rd and 4th year of dental education, but they owe that equivalent. It's either 2 or 4 years. Sorry, I don't remember, back into an underserved area to pay for that. So I think we're going to need society to actually help us figure out ways to reduce the debt. It's something's got to give.
That's informative. I knew that there's some extra pressures on tuition and the affordability of becoming a dentist. If I can zoom out for a second, there's some real challenges. It sounds like there's some opportunities here to try to improve the financial aspect for students pursuing dental degrees and that training. I'm curious, what is the message then? There continues to be a push of people signing up for dental school, but what is the message, would you say, then, to endure these pressures and these unknowns currently? What would you say, Dr. Gallagher? You mentioned about serving community potentially. What does longer term or even the immediate aspect impact of these issues related to how much people can borrow to go to school and how they will finance their education? What do you think? What is the message then from dental education perspective about why? Where are we going with this? Why do we continue to do these things?
So I think there's always a need. There's a need for us to provide this care. There are pathways that you can consider, and I think it's probably on our part, making sure as the students come in, they understand what they're undertaking, but then knowing that there are different pathways. So, for example, if you really want to go down serving your community, as Dr. Altman mentioned, there's opportunities, but also loan repayment through FQHCs. And now, how that will then work with moving forward again is an unknown, because obviously, if you have private loans, are they going to be probably not eligible compared to the federal loans you have as well? But I think part of our responsibility is showing the value in the profession, showing at the end of it, when you actually come out, there is a pathway to be able to service that debt and have a fulfilling sort of life as well. And I think also at the dental school, I think around some of the practice management, some of the education we give the students, we could probably do more around just really how you do your personal finances, how you kind of, estimate what you need to actually get through dental school, to kind of understand that as you're progressing each year for your cost of living, tuition, and make sure that you're probably financially savvy coming into the program, but also at the end knowing that this is feasible to pay off.
Yeah, I was just thinking, Don, you made the comment about the lifestyle that's awaiting somebody that even a new grad is desirable. I get it. People want that type of stability, but at the same time, like thinking that mindset is beyond just monetary. And I just was curious if you had thoughts about the why. What, we need more dentists. There is an influx sometimes for too many, not enough, these type of things. But why should the eighth grader that doesn't know about the profession fully, why should they endure what's coming their way potentially related to the cost and the pressures of being a dentist? That's what I'm wondering if you have thoughts about that.
Yeah, so I'm doing this from a public health perspective, because before I was in education, I worked for state and local government, and people that work in public health are doing it because it's a passion, not because you're going to make a lot of money, because you don't. My specialty of public health is probably the least lucrative of all the specialties there are. So you really are looking, when you're talking to an eighth grader or a college student, or even in our admissions, we're not looking for somebody that, wants to be a cosmetic dentist. That's not even who we're looking. That's not even what the university is about. But we're looking somebody with the right heart, somebody that wants to give back to their community, somebody that likes people, that likes making a difference, that feels like I have the skills, I can do that. Even if I'm in private practice, I can volunteer. So we really try to look at the person and their commitment and their character, as opposed to, do they have a 4.0 and what was their DAT score? Because they can go anywhere, but that's not really what we're looking for. So I think that's what I would tell somebody. It has to be a passion for you. Otherwise, don't do it, because it's not going to be satisfying anyway. But you do kind of have to like people. You're going to be working with them, and so yeah, it has to be a passion. And the money will come. I think one of the areas that we don't do, which I think is unfortunate, which we really need to think about in dentistry and the options for, where you can practice, what you can do, is that it's totally unaffordable for somebody to go into dental education and become an instructor. Young people cannot afford to go into dental education. We don't pay enough in dental education to help them pay off their loan. So unless universities or schools do some sort of incentive for, our school and you pay back, or there's got to be something, because there's a shortage of providers. It's very difficult to find, and I think in all health professions, not just dentistry. So the health sciences is going to really need to figure out a more reasonable way of getting folks that want to teach into the teaching field.
Yeah, those are great points. I appreciate hearing that about the service mindset. I'm pretty new to ATSU, and that's something that I've heard just in my one-on-ones with different faculty and folks around. That service mindset has come up. And I think that's really a great environment to be around. That's human-centered, helping others. Like, what a great environment and a reason to go through years and years of schooling, and definitely worth it. My next question is about faculty. So we've talked about multiple aspects of education and now thinking about the instructors here. How do you encourage your faculty to continuously improve in their craft as educators?
I think one of the things, that I'm not really doing this because you two are doing this podcast, but I really have been a bit advocate of the products that the TLC provides at our university that are free, that are ways to help a faculty member, write a better course, do research, collaborate. I mean, I just feel like we have a lot of internal resources. We do also are always looking at different programs, computer programs, AI generated, getting free samples, and working on then teaching our faculty, like, oh, here's a really good program that will help you design a new course. Faculty don't like doing new courses. They like just using the same course that they've always done. It takes a lot of time to redo a course. But I tell you, like Power BI, I mean, there's some stuff out there that makes it so easy. You give it the right information, it provides you with a lot of resources to help you in your teaching. We do have students that all learn differently. I really don't think that we can be all things to everybody. So I do think that we have a general way of teaching, and we want folks to adapt to future things. But I think to get into that real precision sort of teaching, it is going to be AI that's going to then look at the data and say, this is the person's weak spot. This is what the person needs. This is what special instruction this person needs. This is what they may need. I think all of that's coming. But, again, it takes a lot of resources, and it takes faculty time, and we don't have enough faculty. So it's a real balance. But I do think there are lots of resources out there, back to your question about improving their teaching. A great clinician doesn't mean a great educator. All right. And so I think we have great clinicians, and I think our clinicians could always use help in different teaching techniques to make their classes better, their instruction better, their communication better. And I think, again, I think the TLC is great and has so many resources. And I always wish that faculty would look into those more often.
Yeah, I wanted to continue on where Dr. Altman was talking. I totally agree. I think we're really lucky that we have TLC. I think it's a wonderful resource for a faculty. I try to also, when I talk with faculty, again to Dr. Altman's point, I usually say to them, similar to my own journey, I was a clinician, but then I knew how to do dentistry, but I didn't necessarily know how to teach it. And some of the things that I did was to take opportunities around doing, some further degrees within education. So I really understood how you set learning outcomes, how you assess, etc. as well. And, I really try to encourage all almost thinking about each faculty. So again, meeting with kind of the associate deans or, the senior directors, talking about when time comes for evaluations, how do we encourage, how do we help faculty to kind of see the resources that are available? So again, I think in the role as dean, associate deans, we've really got to encourage people to really use the resources we have as well. I was also fortunate in that I had a chance to go through some of the external sort of programs. So with AAL, through the American Dental Education Association as well. So again, that gives you an opportunity to sort of meet with other educators at a different level, where you're meeting from a lot of different schools. So you get that opportunity as really a melting pot of different ideas. And again, encouraging faculty to look at going to the annual session for ADIA, because there's so many different opportunities to hear about how different schools teach, really the same thing, different ways of doing it, innovation, etc. as well. How, is there an opportunity for us to learn from, other institutions as well? So kind of looking at what do we have internally, but then also other opportunities externally that we can actually grow. And then also looking at supporting each other as well, like peer learning, through our own continuing education. I did some teaching before in a previous institution around feedback, clinical teaching. So, I shared that with the faculty. So again, looking at, how when we learn something, we can bring it back to our institution to kind of share with everybody else to help them to grow as we move forward.
Yeah, so IDEA, we're familiar with. Members of the TLC have actually attended and shared some of our resources and the results from our work here. We're grateful for the plug and the collaboration with all that you all do. We look forward to what's next and working with you all the exciting ways. Let me wrap up by asking a question of each of you to see what's next in your faculty development adventure. Do you have something in the short term that you plan to do to level up your teaching and educational expertise?
I don't teach anymore, so that's not really my focus. My focus, being at MOSDOH this year, is to really looking at the processes and the policies and trying to further those into a little bit more efficient dental school. And so much that's happening with the federal government, I think, that affects the state government, affects Medicaid. I mean, almost 50% of our patients are Medicaid, adult. And if adult Medicaid, which is optional, goes away, how do my students get their education? So I try to stay up on those sort of higher level issues so that I can try to prepare the school for what may happen.
Yeah, on my front, I'm actually finishing off my EDD this year, so I've done all my research and everything. So that'll be my I'm just coming up for defense of that. So I'm looking forward to that. That's been a really great journey. It's something that I've really enjoyed. So then I'm also thinking about how do I continue to grow and looking at do I do the MPH after this, just so that I can focus it a little bit more. I'm trying to see if I can get as many post-nominals as Dr. Altman, but I think that is impossible. Is it 20 doctorals you got now?
I don't even remember anymore.
But so I'm looking at that. Also looking at we have CODA accreditation in 2029. So really kind of a bit like Dr. Altman, really looking at the school, looking at what we're doing, really taking an opportunity to look at, are we supporting our faculty assessments? Are we looking at our institutional outcomes? So really making sure that we're prepared. But I also think with accreditation, the self-study, it's a wonderful opportunity for staff to learn more about the educational process, which I hope will also have an opportunity for us to then talk more about other opportunities in the university, about opportunities around masters, around, doctoral degrees for maybe some of our faculty to continue to grow. And particularly as we look at who's going to be our future leaders, how do we start to think about our succession planning as well? And again, looking at, how do we focus in sowing the acorns of, future deans down the line as well?
Fantastic. And Dr. Gallagher, maybe I could talk to my boss, TLC, and see if there's a spot for you once you finish your defense on the Teaching and Learning Center. Maybe we'll get you over here. But no, all jokes aside.
I'm not sure there's a spot.
Oh, okay. Super competitive. That's funny. Thank you all for being vulnerable here and sharing your thoughts and being so eloquent and well prepared to have this conversation. I'm excited to get these series out, and this one in particular to hear what people have to say about the technology is going to be a big part. And then just even the political landscape and how your profession is being impacted in the short term and unfortunately long term potentially. So thank you so much for this. Before we wrap up, let's take a moment to reflect on what stood out most from today's discussion. Emily, thoughts?
Yeah, I think there was a big focus on the students, very people focused on, there's a lot of technology coming with AI and robots and whatnot, but still developing the student as a whole and what soft skills might be needed, critical thinking and things like that. Those are things everyone is talking about, but to put it in such a specific context as they did today, I think is something that folks listening, that I'm sure that really resonates with.
Yeah, I agree. I was surprised to learn about robotics. I hadn't thought about that. But yeah, of course, the AI wave is here. Simulation has been around for a while, for sure. The discussion on the technology. And I was grateful to hear how they support faculty at all comfort levels with this technology. I know this is something that's near and dear to our hearts in the TLC. There was a lot here for me. I appreciated the golden thread about the learning moments, those, talking about delivering those phone calls and how life-changing those would be for the individual and their families. I could only imagine how powerful those things are. Thinking about, the graduation ceremonies and all those moments in between. But I would say the big takeaway for me, and maybe more of just validation, is no matter what, this is all about moving from what to do to why we do what we do. To me, that's the overlapping theme from everything that we talked about here today. I think that was a big quote that jumped out to me. Both said it in different ways, but we're real good about it. We do it too in the Teaching and Learning Center. This is what to do. This is how to design a course. This is how to build a campus site. But at the end of the day, why do we do it the way we do it? That decision making behind the scenes is really what I think a lot of what we're trying to do with technology and how we apply it is trying to unlock those things. So, it was an engaging conversation. I appreciated their insights. With that being said, I just want to give a big shout out, a big thank you to our guests today, Dr. Altman and Dr. Gallagher, for our very enjoyable conversation. I appreciate them taking the time to share their perspectives with us. And Emily, who else should we thank?
Yeah, a very special thank you to our listeners for taking time out of your busy day to join us. And please take a moment to share your feedback in the comments or by emailing the TLC. And to receive credit for the Level Up Certificate Program, check the episode description for a link to log your participation. And until next time, this is your TLC team, Emily, Erin, Julie, Brenda, and Quincy, saying bye for now.
Bye.
Yay, bye.